you've been inside, if you've been inside the LOU that I sent you, you'll have seen my face already. But I am here with Dr. Crystal Flores, and it took me a long time to practice to say that, but and we are going to present on Latina culture and trauma. Just to give you a background about me, I am a forensic psychologist by trade, one of the first to graduate in the nation with it. I focus on men, I focus on male trauma. And one of the things that I love to do is to help people tell their story. And you can see my TED Talk and hear a little bit more about that and about who I am and read my bio. But I love interaction when we're talking. That's one of the things we're going to do. And I love to hear how you can apply what we're talking about. So with that, I am going to turn it over to Crystal Flores so that she can introduce herself.
Hi, everyone. I'm super excited to be here. I'm Dr. Flores, Crystal, whatever you, Dr. Crystal, Dr. Flores. So I am starting to blossom in my career. I've been practicing for over 6 years now, and I didn't think that I would end up in the position where I am right now, where I am focusing on male trauma. I'm helping to run a clinic right now called the Male Trauma Institute, but it just kind of naturally progressed that way. The work that I've done in the past, I've worked in youth camps, I've worked in treatment centers for addiction. I did community mental health, working with children and adolescents and providing services for undocumented immigrants. And then and then later on, I went into private practice and I started working in more immigration law. So I would help provide psychological evaluations and help with cases where people were seeking asylum or trying to establish or change their immigration status here in the US, which brings a whole host of problems. But throughout my career, I've ended up working with the male population for the majority of the part. And I've worked with Dr. Debra since I was a student. I helped her to start this conference called Script, which she'll talk a little bit more about. And then here I am now talking with her about male trauma in the Latino community. And yeah, it's an honor to be here.
Yeah, and once I meet you, I don't let you go. I have a knack of voluntolding people in my life, but I believe everybody can add something to somebody's life in their own way. So now that I know you, you're my family, and I will find you and invite you to all of my crazy in my life. So, but one thing I like to do, because I like to know my people, I know a lot of people's cameras are off. I don't care if your mic is off and all that, but I would love to see you as I talk to you, because it really provides a more intimate setting. And I like when people ask questions and things like that. So we may not be able to answer it right then, but raise your hand, put it in the chat, all of that stuff, because it's more interactive, okay? And as we present, you might say, oh, I already know that. Well, realize that we are presenting it from a different lens of actually practicing of what we're doing. We're forensic psychologists, so we have to sometimes cover basics so that we can move forward, okay? So, but in the LOU, we're not going to look at them now. There's also hyperlinks to different videos or articles that we found within there. So at your leisure, when you're not doing this with us, please go and look at those things. You might find them useful to show to clients, to explain things on a basic level or elevate it however you see fit to do that. Okay, so that's why we also create the LOU, so it's a tool that you can use when we're not there. All right, so with that, I'm going to share my screen. And can everybody see that?
Yes.
Perfect. Thank you, Sadie. All right, so we're going to go through it, and you can also follow on your phone. But we introduced ourselves, and we want to start talking about what trauma is. And who can tell me what trauma is within this? And just shout it out, because I can't see everybody.
Yesterday, Dr. Warner and I were having a conversation about this because we're like, look, these are all experts. They all know what trauma is and PTSD. But then it's like everybody knows trauma until they're asked about trauma.
Right.
And then explaining it and putting it into words is like, we all kind of get stumped. So this is more so just like, because it's so relevant to what we're talking about today, and we're trying to get everyone to start,
Talking.
Yes. So everyone here is a professional. What is trauma? Can you guys tell us in your own words? How would you explain it to a client, to a child, or to an adolescent?
Experiencing something really frightening and that's overwhelming and leaves someone feeling out of control.
Right. And you can have a direct exposure, you can witness it, you can learn it from a relative or friend. People don't realize just hearing it can be traumatizing, right? As a clinician, I'm traumatized every day. And some days I have to go home, and like yesterday, I had to go to Nordstrom's to buy myself a handbag because I was traumatized. I needed something to relieve that stress, okay? And so, you don't realize that things can happen. It could be a medical procedure. Imagine you're a kid, you don't speak the language of the Latina culture. You have to go to a hospital. They're doing intrusive tests because you've been abused, right? Imagine that. And then you can't even explain to someone what just happened to you. Then they send you to a school where you know nobody. Do you think that that's traumatizing? That's traumatizing, right? But people don't think about it in the context of walking in someone's shoes and living their life, right? Michelle?
Sorry.
Or Michael?
Sorry. It was my
Okay.
son. My mic was on.
Okay, I was just wondering if you wanted to say something. And also, there's, natural disasters. You had Katrina, you had all kinds of things that happen, and just death or hearing about death, right? But one of the things people don't realize is the symptoms of trauma can manifest in many, many different ways. And you guys know there's thoughts, there's feelings, there's negative emotions, there's positive things that happen. People don't realize that, positive feelings add to you like flashbacks or, hearing voices or seeing things, and negative takes away from you. And a lot of times you're traumatized. People say, oh, they're just depressed. No, it can manifest as depression because men are irritable, right? They break things, they, hurt things, they do stuff like that because they're irritable and they can't deal with what's going on and speak it out. Okay. So a lot of times people don't get that even though they appear depressed, they're really maybe dealing with an underlying trauma that's under there. And then you have like the negative affect, you have the irritability, like I talked to, destructive behavior, risky behavior. They may take on jumping out of airplanes or doing things to hurt themselves because, you get many, many tattoos, right? Well, that's another way to hurt yourself. And then it's acceptable to pierce yourself and get tattoos and do all of that, right? And then you may do it in ways that are just reckless. Say you're in prison and you're getting them from your cellie, knowing that you might get HIV. Maybe you want to die. And this is a way to do it because nobody's going to say anything to you. Or maybe you don't want to tell your gang how you're feeling. So you go get more tattoos, or you tell them the pierce, or you tell them, you get in a sparring fight. Because you can't, one thing people don't know is that when you're in a prison and you're in a Latina gang, you cannot say you have a mental health problem because you can't get treatment. If you get treatment, they're afraid of what you'll say. You can get hurt for that or killed. So you see all of them fighting or trying to get in different wings, or you see the kids on the yard, especially if they're juveniles, right? Because if they're a juvenile, they're trying to get, they're shorties at that time. They're trying to move up in the ranks. They can't say that they're feeling this way and what their background is. So you see difficulty concentrating. They come to the clinic saying they can't sleep. They might come in your office and saying they can't sleep. That may be a sign of trauma versus a sign of insomnia or any other thing that's going on. Okay, so these are things that you have to pay attention to. Crystal, do you have anything to add?
Yeah. I wanted to say, someone wrote in the chat, I like that Celine pointed out the loss of control. It doesn't always have to be life-threatening. I love that, which you're going to see throughout the presentation. I think a lot of times when we think about trauma, or even just the general, when you're talking to the general population, to clients, the people that you're working with, if you bring up the word trauma, they think of the big T's. Like, I don't know, I'm sure most people have heard of, when we talk about trauma, big T's and little T's, the big traumas and the smaller traumas. The smaller traumas can sometimes have longer lasting effects because they happen over time, again and again. And they're things that aren't necessarily life-threatening, but they could also be like, sorry, let me backtrack. There was a point I was going to make earlier about the DSM. Something I like about the DSM-5 versus the DSM-4 is that it includes witnessing or hearing about a trauma, when that wasn't the case before. Before, you had to directly experience the trauma, and then they realized, like, oh no, you can have trauma just through vicariously.
Right. And I'm sure you've all experienced that in your lives, or, you know, or you've seen people do that and you have to explain that to them in your office, right? Now, the other thing is that you have post-traumatic stress disorder, right? And you guys all know what this is, so we're not going to spend a lot of time. But this is just something that you can have to look at. But one of the things that I want people to realize is that you can have, one thing people don't get is that you can have trauma without PTSD. So even though you have those symptoms, you can still be traumatized, right? And you can still, your brain, no brain works the same way, and there's cultural components, right? And here's a link for you to look at the next time, but the features of PTSD might manifest differently in men. You have something called intermittent explosive disorder. Who has seen this? Who has witnessed this? Anyone? Crystal, I can't see everybody. Oh, Allison, thank you.
Okay, there we go.
Allison.
Yes.
So you see an intermittent explosive disorder within, and Michael, within your work that you do. And my one of my clients, Alex, he had this, and I had to explain to him what was going on. He was a combat vet. He had been sexually abused from the ages of 4 all the way to 14 by his brother. And his brother would have him watch porn, and his brother would have a ritual about how he molested him. He told his parents did nothing about it in the home. And so when he went to fight in the war, he found himself a place where he could really explode and get his anger out. Well, he started creating that habit. So when I started seeing him, he was with his partner, and he tore up a hotel room in New Zealand. And he just broke everything, broke the lamps, did everything. And then, if one thing about intermittent explosive disorder is the after effects, is that people feel bad. They feel bad that they did this. That's what differentiates it from everything else, is that there's this feeling, they feel bad about it, they know something has happened that they cannot control, and they don't know what to do. It might look like there's a PTSD response, but it's really they're exploding and they're letting everything out. And he would feel very, very depressed about it, but he'd get hungry, he couldn't move, like it would drain him of everything that was going on, and he would just explode. He'd have the IED. And so I said, you know, can you explain more to me about this? And then I started talking him through it. It's like, he would say his hands get hot, and he begins to not be able to control the rage that comes out, right? Well, it turns out he never dealt with all the sexual abuse that was happening in his life. And this is how it was manifesting. And he's a guy. Men can have one emotion. That emotion is anger, right? If they say they're sad, or they say they're stressed out, or they say any of those other things, they're considered weak. And so he could have this anger and these outbursts come out, right? And so it was easier for Alex to explode instead of telling his partner what was going on. The problem is he caused a lot of damage to that hotel room, and now he's facing charges in New Zealand, okay? So now we're dealing with this international law thing that could be happening in his life. And he's like, and I had to explain to him, I don't think this is more PTSD, because you're not having flashbacks, you're not having all these other symptoms. You're having this. And so when he was properly diagnosed, he could get properly medicated and properly treated with the VA. Any questions about that? All right, we'll move on. But make sure you go and look at your links and click on those later. So here are some Did I skip something? There we go. All righty. So there's some key cognitions that go into when you're working with people with trauma, especially traumatized men. And sometimes these are things that I've heard from my clients. I'm gonna die. I won't make it. I'll never see my children again. I'm fumbling through life. They've even talked about how they see themselves just at a distance walking with disassociation, right? Have you heard other cognitions that when you deal with people who have trauma and have things going on that you hear repeatedly over time?
I think one that I hear is, I'm standing on the edge of this pit, and if I look in or if I take any step in, I'm just going to fall in and I'm never going to get out. It's that like refusal to look at any of it because they're afraid they won't survive looking at it.
Right. It's going to suck them in, right? That's some deep, depression and stuff that's going along with it. What else?
I think kind of piggybacking on what Allison just said about feeling like you're in a hole. I'm in a hole and I can't get out. And I feel like I just am digging myself in a deeper hole.
Right. And most people don't realize that 1 in 6 men have been sexually abused. 1 in 6. So you have 6 men in a room, 1 of them this has happened to. 44% of men take 20 years to disclose it to you. 20 years. Now, let me add on another layer. A lot of the research is focusing on people who are more westernized. Imagine if you're of color, because people of color do not talk about this. And Crystal, in the Latina culture, what do you think would happen if they started disclosing this?
Nobody would believe them.
Right.
They wouldn't believe them, or they would be made fun of.
Completely, because the machismo aspect that we're going to talk about later, right? Richard Gardner discusses there's a false belief that men cannot be sexually abused. And you've seen all those things on TV, especially if they have a female teacher who's like 30 and they're like 14, and people don't look at it the same way because of our gender norming roles. Men have to be executives, star athletes, model fathers. I mean, all of these things go on men. So if they have these other things and this hurts them, people don't believe them. 20 years to disclose. I know someone who did not disclose till he was 75 years old because he didn't want anyone to know that he wasn't this pillar of strength. And then there's the vampire myth. Now, who knows what the vampire myth is? You know what? I can't see everybody if you're raising your hand because I'm the one sharing. No one knows? The vampire myth is very important because when men come in your office, this is another reason why they don't disclose. What happens if you're a vampire and you bite someone? You create another vampire, right? Well, if you say you've been sexually abused, especially by a man, what do people think? You're gay or you're going to abuse their kids, right? That's why women get away with sexually assaulting people so much, because you immediately think, oh, he was molested. Oh, he might be a child molester. It's just in your mind. It's from our culture, right? So why would a man say that? A woman saying, well, yeah, my dad, hurt me. You don't immediately think she's going to sleep with her daughter. See our gender norming? That's why men don't disclose. And in Latina communities, Crystal, I mean, you said they wouldn't believe them, but imagine if you said, my uncle molested me. How would that manifest?
If you said that, it would be, well, oh, I'm sorry, maybe somebody else. Somebody else wanna.
Kyra, did you want to say something? Okay, go ahead.
Yeah.
Crystal?
Sorry, I was thrown off. I mean, if a child said that their uncle molested them, I mean, that would cause a host of issues within the family. And not only would they not be believed, but the family might be like, it's very hush hush. We don't talk about those things. Or we resolve it. They would say like, well, we resolve it amongst us, but then you don't seek the proper resources. And the kid never gets help and they just move on with their life and issues manifest later. And I think all of this is relevant because we're talking about men. Like the context right now where we're talking about it is with men later on in life, but it's important to know that because this, I know that the clinicians here are working with children and youth now. So if you know this information now, how are you going to, I'm sorry, if you know this information about the future, how are you going to apply that now to the clients that you're working with to prevent this from happening, to prevent them from moving forward without getting the proper resources or building enough of a relationship so that they do feel comfortable enough to disclose or to talk about these things in the now. Does that make sense? What I'm
Right.
saying? I'm
Yes.
trying to still keep
And
it.
it's,
Yeah.
and sometimes in Hispanic culture, it is normal to not talk about this, to hush it up, because it's happened in so many generations, right? That if you say, well, Uncle Tommy did this, they're going to say, well, that's your Uncle Tommy. And a lot of times people won't come forward because you keep it in the family.
Mhm.
So there's a rite of passage, right? And in our culture, here in the United States, it's a rite of passage that you get your giggles and stuff when you first have sex. The problem is as we talked about in our rape culture, there's a lot of stereotypes around it. When we think of someone being raped, we think of a male, right? We don't raping a female. We do not think of men being raped. We do not think about men being sexually abused. We think about trauma and war zones. We think about gang violence, but we don't think about all these other types of trauma and emotional abuse that can happen. People think women cannot abuse men, but that's not true. Men can't be domestic violence victims. That's not true. And also, if you're a boy witnessing that, you are a victim of domestic violence because you're seeing it and people don't realize that. And then men have the I'm small syndrome. I should have done something. I'm a boy. I should have helped my mom. And then they hide under the bed all the time in their life because they think they can't do anything. They still feel small. Okay. Aaron Langdon in my book, His History, Her Story, talks about this in chapter 11. But also we talk about the Latina culture and we talk about prostitution, right, Crystal? So what do you have to say about that?
So something that I had shared with you is that I've worked with a lot of clients who like adolescents and like older, no, I'm sorry, like early 20s, men in their early 20s, who we're talking about issues that they're facing in their lives because they were basically taken by a family member to sleep with a prostitute. Like if they hadn't had sex by a certain age, the dad or the uncle or somebody would take them to sleep with a prostitute because of that machista culture. And then now in therapy, we're talking about how that's affected their relationship with women or their inability to relate to women or their feelings of inferiority or feeling like I'm not good enough or like now I have issues where I can't stop sleeping with prostitutes and it's causing this other host of issues where I feel like I'm not good enough. I have to pay for this. And that's something that they didn't ask for. It was imposed on them by their family members.
Which is an abuse itself.
Yes.
Right? And so there's these family dynamics and these boundaries that are crossed, right? But Crystal, you talked about machismo. Let's go through some of these terms that people may not know about the Hispanic culture and how it links to abuse. So on our slides, we have machismo. That's the first one. Let's start there.
I was reading this here. Older generations in the Latino community make their children give a hug. Oh my God, yes. About older generations in the Latino community making their kids give hugs and kisses to everyone. Oh my God, that irks my nerves. That's something that it's cringeworthy because it's like, that's where there's a section where we talk a little bit about generational stuff where it's like you have the older and younger generations and there's this in the Latino, I'm going to go back to what you were saying right now, but this was I think a really good comment and point is
did someone make a comment in the chat?
Yeah, someone commented
loud for everybody so
yes,
yes,
it
we're
says,
not on the same page.
Yeah, sorry, it says older generations in the Latino community make their children give a hug and kiss to every adult to say hello, even if the kid doesn't feel comfortable and it's seen as disrespectful. That's so true. And it's like in Latino culture, respect to your elders is a big thing. And not giving a hug and a kiss can be seen as a sign of disrespect. But if your child is not wanting to do that, especially with a particular adult, there could be a reason. There's probably a reason why, and we shouldn't force them to do that. But yeah, I thought that was a really good comment. Back to the cultural.
Machismo, yeah.
Yes, cultural considerations and machismo and marianismo. So how many people are, just raise your hand if you're familiar with, if you've ever heard the term machismo.
And your hand, there you go.
There we
Okay.
go. Yes. Okay. So if people are familiar with this term, so marianismo is the counterpart to machismo, and really it's just masculinity, the way that you're supposed to express your masculinity in the culture and assert dominance, and this sense of like masculine pride, empowering strength in relationship to women. And Marianismo, its counterpart, but they also interact with each other, is how females are supposed to behave. So, okay, children and adolescents are seeing these behaviors, these machista behaviors modeled to them, and they're picking up on that. Even though things are starting to change now, it's still very strong within the culture, and we're just starting to like bring some of this stuff to light where younger generations are starting to say like, maybe like something isn't right here. But it's the machista aspect and the marianista aspect cause a lot of issues, because if you're supposed to be masculine as a male, how are you ever supposed to feel, or like hyper masculine? How are you ever supposed to say I was molested? Or if you haven't ever seen anybody model like being able to express that and without having pushback or without feeling safe enough to say that. Yeah, I hope that makes sense. But
so what about witnessing or experiencing discrimination?
let's see. All right, so witnessing and experiencing discrimination. So you could have within your family, like, sorry, earlier I was thinking about this, and I wanted to talk a little bit about colorism, because within the family, you could have, a lot of times you have like, are people are familiar with colorism, right? We know like that's like internalized racism. Sometimes like in the Latino community, if you're like darker versus lighter, you might be more likely to experience discrimination. So if you're out with your family or your friends and you see that your darker family members or friends are being discriminated against, that brings up something inside of you. It brings up anger, and it could be sometimes that in itself could be a form of trauma.
So another thing is exposure to familial gang violence or community violence in the neighborhood, right? And these are cultural considerations, like I told you about in the prison settings. Like, if you're raised in that and that's what you think is going to happen in your life, right? You believe that that's the trajectory of your life and that's where you're going to end up. So a lot of times people begin to fulfill that prophecy within their neighborhood and community because they also have no one else to tell, right? And so there's substance abuse, there's health issues. A lot of times in the Latina community, and Crystal, you can talk to this, is that there's somatization of symptoms. So their stomach hurts, their head hurts, but they're not calling out exactly what's going on, right? Like in men, we talk about anger, but there's other things, right, Crystal?
Yes. Yeah, it's much it's acceptable to express that you're having somatic symptoms like head, especially, and also with kids. That's like a whole other layer where with kids, they if you think about it, okay, you're Latino and you're a child, and then what is it? Okay, you don't have the words to really express how you're feeling, you're gonna say, you might have a lot of stomach aches, you might have a lot of headaches, frequent visits to the nurse, frequent doctor visits, unexplained illnesses, that later on for some children develop into like chronic illnesses like chronic pain and stuff like that. So yeah.
Right. But there's language barriers. I mean, that's a big one. There's police brutality. There's lots of things that come into that are cultural considerations, right? And then also you have to look at the perspective of the trauma, right? So there's childhood trauma, there's household, there's divorce, there's violence. But one thing that I learned from working in this environment is there's a collective trauma and there's political turmoil trauma that comes into that, right? And I know, Crystal, you had a lot of thoughts on that.
Yes. So I wanted to back. Can you go back one more slide?
Which,
Just go back one right there. Okay. So something that I think is really important to consider is that within the Latino population, there are a lot of variations culturally. So it's not like a one size fits all. I think that this is sort of like I think of it like, okay, you have an intro when you start looking at Latino culture, but then within the population, it's really important for you to get to know your client and their background and not assume that they're like, I think a lot of people, especially in like LA and Southern California, just assume that people are Mexican, and that is not the case. You have Afro-Latinos, you have Central Americans, people from Guatemala, El Salvador, Nicaragua, Honduras, and all of them have their own little subtle differences. And even within Mexican culture, it's like you have talking about levels of acculturation or which generation your client or their parents are from, that can cause differences. So I just wanted to make that note because it's something that I'm kind of going to keep referencing throughout the
right. And even the reference of calling it Latinx versus Latina, right? Or Latino, that is a cultural thing, right, Crystal?
Yes. We've had conversations about this with the whole Latinx or Latinx and Latino, Latina. You'll see in our presentation, to the way that I use Latinx, because I think it's been politicized a lot, is I use it as a term to be all inclusive of when we're talking about genders. But in the presentation, we are talking about male trauma, and that's why you'll see like Latino throughout the slides. But yes, we've had conversations about this.
Right. And it depends on where someone's from and how they want to be categorized. And it's always better to ask. But back to the political turmoil,
Yes.
there was a lot of insight that we had that I learned about from you about when I treat these populations, about things I didn't even think about come into play within the room.
Yes. So one of the things that you want to ask about is the country of origin, because depending on the country of origin, they might be seeking asylum from a country, like for example, like most recently with El Salvador and Guatemala, there's a ton of political turmoil that was happening within the country. And even if your client, let's say that you're the child or the adolescent that you're working with isn't an immigrant, but their parents are, that means that their parents are dealing with like fear, with maybe they're taught to be very submissive from depending on the country that they're from, and they're not supposed to give any pushback to authority figures because of that political turmoil. That could cause issue. They're now going to take that trauma, the parents, and pass it on to their children and teach their children to be submissive, to be quiet, to respect authorities, to shut up, which can cause them to want to disclose even less because they don't want to open up to authority figures.
Right. And, one of the things that people don't realize is that, people have stereotypes, but imagine living every day wondering, if someone's going to discover you in this country, or, just driving is a fear, right? I didn't realize that. So I started working with the population, right? But, you know, there's a lot of things that happen. Like I work with a client, he had mental health issues. He was scheduled to be deported and but he was trying to seek asylum. Well, if he goes to his country, which is El Salvador, he's shot on sight as it being an ex-gang member. He was psychotic, right? And he's had it ever since he was a little boy. And he couldn't get his medication there. And so having to work with him and having to figure out a journey to help him because of all of these other issues that were compound in there. And then you have a language barrier. He was from here his whole life and he didn't speak Spanish and now he's gonna go to El Salvador. Like, you know, there's a lot going on within that. And it doesn't matter what you agree with politically, it's what is going to work within that client's context of what's going on, right?
Yeah, you just triggered a bunch of other things, like with deportation. If you go back to your country, when you're going to like a country that has political issues or is war torn or whatever, and we don't even have to go that far. Like I'm thinking about Tijuana. If you're from here, you get deported to Tijuana and you have to stay there. It's similar, like whether it's there or in like I'm thinking about El Salvador. You're either going to be, like you said, targeted by law enforcement, or you're going to be recruited to a gang, or you're going to join a gang for safety because you're not going to be out there in the streets by yourself.
And imagine if you're treating the kid of this whole environment. These are all issues that you have to deal with in the therapy room. This is a possibility of what could be happening to their parents, to their brother, to their sisters, and what is going on, right? And that's traumatizing within self because they're a kid, they don't know this, and they're being traumatized by the future that may not be set yet, right? And you have to think about, they're traumatized by something that they're afraid of happening. And then men, there you have a little boy in there, he can't tell you that he's afraid. All he can do is go get in fights all day, or curse out his teacher, or not turn in his homework, because his mind is preoccupied with this fear because he's traumatized of the fear. See, you got to connect that environment to working with our young men. Or walking home every day and he's afraid of who he's going to encounter, but he can't tell you that he's going to encounter. Any questions so far? Any more stuff in the chat?
I didn't see anything in the chat.
All right, manifestations of trauma and male trauma. And, you know, there's lots of different ways. There's patterns and there's cycles. A pattern is something that you do. A cycle is something that comes around and it happens again, right? Like a lot of men who've been sexually abused, and this happens with women too. The men, is anniversaries of certain dates, especially if they disassociate, will bring on a disassociation. I have a friend of mine who has DID, and I always know when someone else is in control because his text messages appear in a different way. And then I have to look at the calendar and know what's happening and who's taking over so that he can move on in his life at that time. And so I look at those cycles so I can manage the relationship, right? And then you have anger, people being angry, and you have triggers to the anger. Criticism is a big one in male survivors. If they think that you're saying something negative, they're going to react to you and you're like, what does that mean? That means I don't understand why you're angry right now, because they heard something else. They will hear criticism, right? Because you could just say, hey, Johnny, you didn't take out the trash. They hear that they're not a good son. They hear, hey, I'm not being a good father because I'm not taking out the trash for my kids, because it's how you phrase it. So sometimes just phrasing it changes how the male survivor hears it, because they already think that they're bad because they've had this thing happen that they can't talk about. And if someone finds out that they were sexually abused, or someone finds out they're an abused person, then they're going to think they're bad. They're going to think they're dirty. They're going to think all these things. So the minute you say they're doing something wrong, oh my God, they may know, and they act out to change it and to act out and be more masculine. Okay, so that's where those roles come in, especially in the Hispanic culture. Just yesterday, I had a guy, I was in the prison and he was acting out. incredibly acting out. And he kept, saying to the guards he was going to get him, and he was going to, but he wasn't hitting anyone else. He was just hurting himself. And I'm like, what is going on? There's more to this. There's more to this. And finally I said, what's his history? Where's his parents? And they're like, well, he doesn't have anybody. I said, he doesn't have anybody. Okay, so why is he just in there destroying everything? And every time you come to the door, he's trying to keep you away. He's not trying to hurt anybody. He's just trying to make sure his needs are met, because whatever he's doing in there, that's safer than coming out of that cell. And it turns out he was raped. And so they were missing this piece. I'm like, he's not trying to, they're just saying that he's being volatile. I said, he's not being volatile. You got to figure out what the propeller is to this behavior. And there's expectations, and then there's intimacy issues that happen. Can you think of other things that happen with men that are distinctive, that you're like, hey, that sounded odd that he did that, but I wonder if it may be a manifestation of the trauma he's occurring?
Or male youth.
Or male youth, yeah.
Because by the time they're adolescents, you can already start to see, well, even children, you see it in children. You see in children and adolescents that they start to act out, or they start to do these things, and you're wondering why. Or you see it and then you find out a piece of information later, and then you connect the dots. Oh, that's why they did that.
Right.
That's
right.
why they started wearing baggy clothes.
Right. Or they make a life script, right? So something that men do and people do is that they make life scripts of how their life is supposed to be, because they're supposed to be in this way that society has described, right? But the problem is their life scripts don't match what's going on, because they have all this other stuff going on. So when you make a script about, you go to the grocery store, you go to the counter, you pick up the food, you put it in the cart, right? Well, imagine their script is, I go home, I eat dinner, and then all of a sudden I hear footsteps coming down the hall, but I can't say anything. I can't breathe. I get up the next morning, and then I can't express what's happening. And then I go, and I have to go to school, and I'm holding all this in. I've been holding it in for 20 years. I hit my best friend for no reason. They ask me why, and I have to make up an excuse, right? So your life becomes this pivotal thing, because the minute you say something, and then they say, well, come talk to us. And then they say, okay, well, I can come talk to you, and then all the programs are geared towards women versus boys. And so you're like, I don't want to be the only guy in there. I don't want to be the only one guy saying this. And then my friends talk about this, right? And then imagine you're in the Hispanic culture and it's a norm to not talk about these things or somatize these things. Then you have this whole script of how your life is supposed to be, and you never get there. That's why there's 44% that's magnetized when you're in a different culture. That sounds anxiety provoking, just hear me talk about it. Like,
yeah, like living your whole life that way.
Imagine living your whole life that way. Imagine you're 6 years old living your whole life that way.
And I think that so you're having this internal experience, and also the people around you are now starting to perceive you in a certain way and giving you this feedback that starts to solidify like the personality and the person that this child or adolescent is going to become as an adult.
Right.
That's why a lot of children who have like a conduct disorder or ODD go on to have antisocial personality disorder later on.
Right. Right. Totally. So Crystal, I think, was this your case, the case of Ricky?
Yes.
Okay. So
yes,
we're going to
okay.
give you a case example to bring all of this crystallized.
Yes. Okay. So I had a client, adult client, and I promise I'm going to circle back to children and adolescents, but so he was in his late 30s. And I was seeing him because he had been in an accident and he lost a limb. He lost like the bottom half of his leg, and he was severely depressed. I mean, I worked with him for over a year and a half, and he made some slight improvement, but even towards the end of that time that we worked together, he was still pretty depressed. And the reason why he was depressed is that he was he had previously been the sole provider for his family. He had 3 children and he was married. And so he was fulfilling that role of being the provider, of being going out working and being and providing for his family and being a good husband and a good father in that way. Prior to the accident, he also would play with his children a lot. He would take them to parks. He would do sports with them, and something important, he used to ride a motorcycle. That's how he got in this accident, which adds to the masculinity, because afterwards, yeah, he kept saying things during therapy like prefiero morir que vivir así. He was Spanish speaking, so I'd rather be dead than live like this. Like, I'm not worth anything, no valgo nada. What else would he say? He would say things like, no sirvo para nada. I'm not worth anything anymore. Because he was an immigrant from El Salvador. He didn't have a lot of education, and he primarily he worked doing manual labor. So after the injury, it's not like he felt confident enough to be able to say, yeah, you know what, I'm just gonna go back to school. He had the language barrier, and then he didn't have the education previously, and then he had some of his own issues that he brought from being an immigrant from El Salvador. So now all these issues are all of these things that he's facing, the depression, some PTSD features that he's having from having been in the accident, losing his limb and all of that, and then dealing with the health issues that come along with that, because that was another layer. He had to get a prosthetic, and he was like embarrassed to walk out with it or go places with it, which is preventing him from having continuing to have a relationship with his children. So the children started seeing him, and he would say this to me, like, he was embarrassed that he was behaving the way he was in front of his kids, where like he was having anger outbursts. He was getting into fights with his wife all the time. But it was all his stuff. It was all the internal stuff that he was dealing with that he couldn't express. The majority of the time that we worked together was me trying to teach him or give him the language to be able to even express what was going on inside of him. And it took a long time for him to even be able to start to verbalize, like, well, maybe I'm doing these things because underneath everything, I'm sad. I'm sad underneath all of this anger. And then it was sad because the children, so with the children, what they started having issues in school. Their grades started dropping. There was an infant. There was a child who was in elementary school, and then a teenager. The teenager started acting out, started getting into fights, and I think eventually ended up like running away a few times while we were working together. And then the child started having anxiety. He didn't want to go to school. He was worried about his dad. He was taking on, starting to, like, you could tell that he would worry about how his dad's mood and his dad's emotions. And I could see, I knew that based off of what dad was telling me about what was going on in the home. But, and something interesting about this case is also I got to testify in court, and we talked about how machismo and all of his background history played into his depression and his inability to move forward with his life, which was currently affecting his children and his wife, and would later on continue to have effects on the family. So that was the case of Ricky.
So it had a lot to do with the family environment of what was going on with the dad. And then each of those kids was also getting therapy because of the effects it had on him because of his trauma. So those kids became more traumatized because of that. Mm-hmm. And that, I mean, I remember you testifying on that case and having to explain that to the court, because they didn't realize that this is you know, this is really mental health here. This isn't Ricky not doing his job. This is not all of the things that people were thinking in their heads. There was a lot more going on here that was a deeper dive, and getting the courts to understand that we need to help these kids because of their father's mental health issues.
Right. And I like this. I like this case in particular because it's like, this is a great example that it, like, I think, again, going back to the big traumas where we're not necessarily, Ricky may have had other traumas, but the major trauma we're talking about here was an accident and a loss of a limb, and not necessarily like sexual abuse or those kinds of things.
Yeah, we have a question. When parents are experiencing trauma, sometimes the children can feel like they're walking on eggshells around the parents. Yes.
Yes.
And they
yeah.
don't know what to do.
Yes. And
Excellent.
they're literally holding their breath. That's where you get into the somatization of stuff, where it's like these children are starting to hold tension and hold their breaths in their body, which causes stomach aches and headaches and things like that.
Yeah, and that's where we get into the general, you know, physiological effects.
stuff.
I'm not going to read all of these, but when you have trauma, a lot of these things happen, especially like diarrhea, stomach pain. We talked about that, right? That is very similar in the Hispanic community because it's the somatization of the symptoms, okay? And then interpersonal effects, conflicts, aggressiveness, withdrawal. And I tried to pick out a lot of the things that were particularly prone to men. And then you also have to look at the mediating factors, you know, prior experience with a similar event. It keeps happening to you, like it goes over and over. Maybe they're creating it because that's where they feel safe. Like I told you about the guy in the cell, he was creating that drama because he felt safe, right? And so there's an intense disruption in these people's lives, right? And being believed and feeling as such. One of the things I tell people when a boy or a man discloses to you, it's so hard for them to tell you that, right? One of the things I tell people to do is stop talking. Just stop and listen to the entire thing, no matter how much time you have or little time you have. And then you say, I am sorry that happened to you. And then the other thing I do is I thank them for telling me that story. You know why? Because thanking them for telling me something so difficult is an acknowledgement of that pain. I cannot feel the way that they feel, but I am the vessel that they have chosen, because I can tell you now, if you stop someone who's disclosing something like that, especially a man, they will never tell anyone else again because they already believe that it will not be. So disrupting that flow. And that is something that they have given you and trusted you with. Any questions so far? You guys are making great comments. We're in the room, see, I would be picking on people. I guess I could do that. There's Zoom. Allison?
I have a question.
Yeah.
I'm wondering, you know, you shared that you don't want to interrupt the process, but how do you ensure that they're not becoming overly flooded or being immersed in a flashback? You know, sometimes we encourage clinicians to pause or to have them check in somatically. How do you check on those things when you're inviting them to share?
Well, that's the key, is that it's not even inviting. They begin to flood on you. And so it is, you know, you can tell when someone's overly emotional. You guys are all trained clinicians, right? But with men, if you stop that process, they shut down because they want to get it out. They want to tell you, right? And they will tell you if it's too much, they'll stop talking themselves. That's where they begin this process of healing, to let that pain, they've been holding that pain in, to stop it. You're now telling them, stop sharing, stop that process, right? I've been with people in many different settings, and I was like, oh my goodness, okay, this is a lot, this is heavy. But I let them finish their sentences and I say, hey, thank you. I'm sorry that happened to you. You want to continue? Is there more? Right? I allow them to tell me when it's time. And that's allowing them to have control of their trauma for the first time. And that's what I'm teaching more than anything else. There's all things you can do when someone's overloaded. You can 5150 them, you can get them more support, you can set up a system, but right in that moment, I want them to begin to learn that they can have control of that situation and their journey.
And especially, so working with children and adolescents, like a lot of times if they're having these like, quote, big feelings, right? Like they're having these big feelings, they may not have ever had the space for somebody to be able to hold that for them. So remember that as therapists, like I think that the most important thing that we bring to the table, aside from the training, aside from our education and everything, is just being able to sit with them. Being able to sit with them and hold space for them. Because a lot of times, like going back to everything we've talked about, if they've ever inched at even expressing some of those big emotions, whether it's just through crying, sometimes you just get crying. Sometimes you don't even get words, but you just sitting there with them and you just stay there with them. And in the past, they may have been shut down. They may have had somebody tell them like, no empieces a llorar, don't start crying. You know, or
boys don't cry.
Right. Or yeah. So we are the container. We can be the container. And of course, that's where if we see that, okay, things are starting to go overboard or they're starting to hyperventilate or something like that, we bring in our clinical skills and we start to help them to start down regulating.
Yeah. And not everybody reacts the same way to the same crisis. I love to talk about I'm a big fan of Stephanie Meyer, and I love to talk about her books. And the vampires all have abilities, right? And so the thing is that like Bella can do stuff with her mind, and she has her shield and all this stuff, right? But someone else is a human shield, but it manifests a different way, right? Because that's because not everybody's mind is put together and works the same way. You each have two different parents, chromosomes, all that, right? And so trauma is not going to manifest the same for me as it is for Crystal or for another guy, right? So that's where you bring your clinical skills in, but you also listen to how that trauma is manifesting, because we have different personalities coming in. We have people who are introverted, we have people who are extroverted, right? And then you have other disorders. Imagine an extroverted borderline telling you about their trauma. It's going to look way different than an introvert under his bed. And so, see, you got a picture of somebody, didn't you? And so, different. And so it's good to have that emotional intelligence, of yourself coming in. What just happened to my screen? I do not know, but you got me. Here we go. My Instagram is going up, but and so you have to have your own role modeling of that within the system and providing that support. That's an excellent question. And then you have other stuff: emotional effects, anger, sadness, PTSD, conduct disorder. Chris talked about going to antisocial personality disorder. Also, other personality disorders I've seen too. Just because of the traumatic stuff that comes on. Has other people seen other personality disorders develop due to the trauma of the past of the kids?
And that could be maybe that's like later on. Remember that with the personality disorders, a lot of them you don't diagnose until they're adults, but you can start if you look back at their history. Or you look back at the history of disorders that they had as children and adolescents, you can kind of see how it turned into something else.
And they have traits, right?
Yes, traits. Yeah, the character traits.
Allison?
Yeah, I think we see a lot of the attachment issues that can manifest into, things like borderline traits and things like that. But with our youth, attachment's definitely on display, and we do our best to try and regulate that, but also teach parents what's going on. And then we also see adults at our agency, and then we can see kind of those after effects when those traits kind of blossom into more severe disorders.
Right. And there's a good book, I Hate You, Don't Leave Me. If you haven't seen it, it's about borderlines. It's amazing. And so there's some cognitive effects, impaired concentration, decision-making, beliefs, right? And when the problems usually manifest, something happens. With my own husband, I'm married to a trauma survivor, by the way. When my son was born, my husband died in a way. I got a new husband. That's what I feel like, because his trauma went off the hook. He became this different person that I didn't marry because he was so invested in this not happening to his son. And I'm like, yeah, but you have to let him live his own life because I don't know who you are. But that event triggered all of these things that I didn't even know about, right? Because a traumatized brain, you never know what's going to happen, and their history is not linear. You think they're lying. No, you're not lying. They just don't remember it in the same order that you remember going to Disneyland and walking in there. That's totally different because an event has happened to shift things around that emotion, and those emotions that are happening, the brain does not come out the same way, right? And children often recant. They seem like they're lying. When they put them on the stand, they say that. That's why they do so many forensic interviewing. But the thing is that their little brains are still developing and they don't quite get it. And so listening is the key. And one thing I always tell therapists, because you get, especially when you're working with kids or people who are really damaged, you can't fix it. You didn't do it, you can't fix it. What you can do is provide the support. And it's hard for a lot of people. You can't fix it. You can help them fix themselves. And that helps give perspective and role modeling of what they need to do. Okay. Later responses, you have the fight or you have the flight. and I love when, have people, you guys probably all know this, but when I'm on the stand, this is the example I give because the jury usually doesn't quite get it. And you guys will all eventually end up there somewhere if you're working with trauma. They want to know why trauma survivors might be hypervigilant or it happens all the time because, okay, your nervous system is always on if you have trauma. Right? Imagine that you have all of these chemicals in your body, right? And in caveman days, they would turn on because there's actually a bear that's going to eat you. All you have is a spear and you got to run and you got to get away from it, right? Well, okay, and then it stops. But when you're traumatized, you are always thinking people are out to get you. If you're in a war-torn community, if you have the uncle who comes into your bed at night, all of that's happening. You're always hyper vigilant to the bear is going to eat me, and you're always running because you can't turn off that ticker tape, especially if you're keeping in an emotion, right? So in certain communities, and you're in a community where this is happening all the time, that's going to happen. And you distrust people. You think God's abandoned you. You have distortions of time. All of this happens, right? You're an actor in your life. There's patterns that happen within that you cannot control. Okay, Crystal?
Yeah, no, I'm just like nodding because I'm thinking about like the biggest thing I can think of is this sense of paranoia, and just that always thinking that people are out to get you, and I think about with children, you start to see a lot of anxious features and anxiety stuff coming up, or the skin picking, hair pulling, those kinds of disorders start to pop up, and that's because like if their parent is always hyper vigilant and looking behind their shoulder and thinking that like no you can't go, like earlier when you talked about your husband, I started thinking about when you're with parents who were abused and now are afraid that their children are going, let's talk about in particular sexual abuse, they're afraid that their children are going to be sexually abused. You don't let them go anywhere. You might not let them out of your sight. You start to become hyper, and some of those things you need, yes, be vigilant, but then it starts to become excessive and it starts to cause issues for the child.
Right, and it manifests in later life. You all have done the ACEs. It's on here if you want it. We don't have to go through it. You all do it anyways. I encourage people to check their score because that is what happens later in life. You have all of these things that come into it, right? But the thing is with survivors, they don't realize that all of those things happen. There's a lot of education that goes into it. I know Dr. Valetti very well, and he lets me use the ACEs all over the place and in different languages and put it in my course because he believes in it so much, right? But this is something that's really interesting, and Crystal's going to tell you about this, what happens with the ACEs in Latinx communities.
Yeah, so there's I forget there's this organization, I think it's called Salud America or something like that, but I found a ton of great information from that organization where they were basically looking at childhood trauma in the Latino community. And there's a really cool video where they basically are summarizing the research. And in this research, so they found that almost like I thought the numbers were crazy because I'm thinking almost 80%, 78% of Latinx kids suffer from at least one adverse childhood experience. And that could be, of course, we know, like, right? Abuse, neglect, exposure to violence, substance abuse, household dysfunction, poverty. I think that's a big one that we don't think about the effects on that. But yeah, almost 80% within this population. And then 28% of US Native children suffer from 2+ adverse experiences versus 60% of immigrant children. I thought that was another interesting point because something that I'm going to touch on later on is that higher levels of acculturation could sometimes cause issues for Latinos. So for example, like a fact that I found was that women who are more acculturated Latina women who are more acculturated tend to have multiple partners. And what does that mean? That means that if you have children, if you're a mom and you have multiple partners, you may be placing your children at higher risk for abuse or exposure to things like domestic violence or things like that. So something important to think about that level of acculturation. And interesting that there's higher adverse experiences for US Native Latinos versus immigrants. And then children exposed to ACEs are more likely to develop, physical, mental, behavioral, psychosocial, or cognitive stuff than children who have not been exposed, which that's kind of like, yeah, we would think that.
And also the ACEs is a great treatment plan tool. People don't realize that. I give the ACEs, especially to certain cultures, and figure out, and I ask them how they're going to answer the question after they've done that. So I follow up with that, but realize a lot of times you're not going to get a direct answer from your ACEs score. So you might say, oh, they scored a 0, great. No, you need to go back individually because in this environment, they're not going to tell you, right? Especially if they've been caught up in the legal system in any way, they're not going to answer this accurately. But if you sit there and ask them one by one, ask them the questions, you're more likely going to get a response on that. And also, if they leave it out and then later they tell you, that tells you a whole lot about what they are hiding to you. Or you can get the translations in their native language, which makes it easier for them to respond to you.
Right. Like how many clinicians have experienced like that you maybe give the ACEs at the beginning and then you start to do treatment and then stuff starts to come out later and you realize that their score is higher than what they originally reported? Anybody?
Denise, good.
Thank you, Denise. Yeah.
Yeah, and also I will also add whatever that question is as a treatment plan goal to get more information and build reports. Elaine, good. Because I know that is really important. And then what does research show? Studies looking at gender trauma and clinicians, girls reported higher PTSD scores than boys. Now we know why, right? We've talked about that. High family conflict predicted in PTSD symptoms in boys, yes, but not girls, correct? Because men are the aggression. Hispanic youth experience higher rates of victimization compared to Caucasian youth. Now, why do you think that is? Bueller, anyone?
I know I'm like, I want to jump in, but I'm like, I also want other people to participate and think about that, why that might be. If they feel comfortable.
Go ahead.
I mean, maybe immigration experiences and police, brutality, racism, those kinds of things that they may experience more.
Yeah, very good. Crystal?
Yeah, and related to that, Latinos, I'm careful not to overgeneralize, but they have bigger families. They have bigger families. They have more people living in the household. If you're talking about things like immigration and you have somebody, a lot of times families house immigrants that are coming through. So you have more people coming through your household. Dr. Debra and I have talked about this, where she's like, Crystal, why is that? Why is there always a bunch of people living in the house? And I started explaining to her these things, like you have people, the more people you have living in your household, that creates more complex dynamics and more opportunities for children to be victimized.
Right. And males are more likely to display externalizing symptoms, which we talked about, other problems and things like that, right? So Cody, let me give you a case of a kid and that will kind of crystallize this. Cody, oh my gosh, he was about 13 when I got him, and he was about 6'4". He was a big kid, and he was in foster care, and his birth mother wouldn't feed him because he just kept growing, and she felt he ate too much. So she would lock all the food up in padlocks and keep a key around her neck. Now, Cody, being as big as he was, could break the locks, okay? And so she began to chain him to his bed. And there was a language barrier, and there was other things going on, and the family couldn't figure out what was going on with Cody. And then Cody ended up in a level 14 plus, was when he found me. So level 14 is the highest you can go. This is the plus. That means the kid is that volatile, right? Remember, we're dealing with language barriers, we're dealing with family dynamics, we're dealing with cousins, he's been taken away, we're dealing with a lot of things, right? And he was a very angry kid, and he was very violent, and he would act out. But the one thing I noticed is that he wouldn't hit me, and he wouldn't hit women. And so there was a cultural component there that he learned not to do that, right? So I began to figure out, okay, female staff, he has a gender preference, he has all this, but what is all of that about? And so I started learning about his culture, learning about him, and he had this thing for fairness. And when I came into the scene, I found Cody screaming at a male staff and hitting him because it was the staff member had taken a French fry off of one of the lunch trays. That he believes that's their food, they have other food, and he was violating him in a way. And so I began to work with Cody to understand, hey, there's other people in the world, because he was so self-centered and propelled everything around him. And so I had to begin to have him realize that there's more in his world, in community. And I decided that one person had to redirect him. So if they were on a shift and I wasn't there, it was one person redirecting him, but redirecting him in his own language. Because Cody, he had a hard time. He was still transitioning to English. He was neglected. He didn't go to school. There was a school on site, and I began to work within my cultural parameters. And he needed one person because he was triggered on everything, and he was brought in a place where he knew nobody, and nobody around him understood where he was from. And so I became that person, and I would stand there when he was in these rages, and I go, count, Cody, and I go, uno, dos, tres, and we would just begin to count down from 10, and eventually he would do it himself, and he would count backwards. And all of his things, he was so, everything that was happening to him and happening to his body was happening all at one time. And he was 13 and 6'4", right? And so we progressed on in his life. I think I had him for 2 years. He ended up reaching 6'6". He did learn English, but he could never reconnect with his family. He was permanently taken away. His mother didn't want anything to do with him. And a lot of it was because of the way he looked, and because they were scared of him. And we had to deal with all of those masculine stereotypes that were put on him, and also put on him from the community that he was in. And he believed he would end up in prison one day. And I'm like, you don't have to. You're not there now. So we started progressing him into getting into a 6 bed, to where that was a step down, and then getting into a community living, and then getting a high school diploma, and doing all of these things so that he could meet his goals, right? Because he believed all that stuff from his early environment. I mean, he was already prone for prediabetes because of everything that had happened to him, right? So I had to start back from step 1 and look at all those triggers, and looking at his sense of fairness and working within him. And the reason I made one person, because I had to take all the noise out of his world. All that noise was just too much, especially when you're trying to learn a language, and take that into consideration. But what do you think Cody's ACEs was? Anyone? We got 5, 12, very high at least. Well, when he came in, it was like a 1 or a 2. Why? Because, well, we couldn't get the information. And then at the end, it was like a 7. Yeah, it was very high because he had all of those things in his life. But that's where I had to look at it. This is not accurate. I know I have it, but I know this isn't accurate. And I know what is going on, that this is another one I made to know that information, part of his treatment. Any questions on that? Let's see, we talked about fight or flight. One of the things I did was teach him how to regulate his emotions and look at his distrust. He really believed God abandoned him and life was just not fair. And I had to realize, God, you know, I know you have this belief system, but tell me why. And I would get all these things about how God, you know, because he believed this, was still consistent, trying to change that automatic thought. We did a lot of CBT because I had to change that over time, because that was his internal belief that he'd end up in prison and God abandoned him. And, you know, a lot of male survivors look for things that are not truthful because they could not believe anything in their life. And the distortions of time, Cody couldn't remember anything in a linear fashion because he was always chained to a bed. So he didn't really know what time it was a lot of times because he could never move until morning. And, you know, events and memory, his worldview was like he was, you know, people were just watching him because he had no one to pay attention to him, you know, and these were his patterns in life. So what is emotional regulation? It's the ability to manage emotions. Could be positive or negative. There's a link for you in the next one. Can have thoughts, sensations, or stimuli, but it is for men to manage their anger, because men are supposed to be doers, problem solvers, be behaviorally focused to move forward, right? But men talk when they're ready. That's the one thing, those of you who are married to a man or a woman, the one thing about men is that if they tell you that there's nothing wrong, there probably isn't, because men will talk when they're ready. And when they're ready to talk to you about it, then that means they're ready to talk about it because they reflect it, because men are fixers. Women are emotional, and men are hunters, other people are gatherers. So they want to fix the problem because that's how we're socialized. So when they're there, they have a solution. So listen to the whole solution. Don't shut it down, because a lot of times that will open up that you want to listen, you want to be there. A lot of times you'll get more information if you let men, especially men who are traumatized, come to you versus following them. And how do you regulate what's healthy, what's not healthy, right? Ask kids, especially boys, what works, what doesn't work. I had a kid that he used to punch holes in walls. And I said, okay, that's how you do it. Let's get you some drywall that you can crumble up and then put away when you're done. So I changed that behavior to where it was something appropriate. I had another kid that would pummel balls against the wall. Okay, but pummeling a ball against the wall is better than hitting someone in the head, right?
There was a question in the chat. What do you do in the case of court-ordered therapy for men?
Can you elaborate on that? What do you mean? Just a little bit, Denise?
Well, you were talking about men, when they're ready, they will talk. And I'm thinking, you know, court-ordered therapy for men, you know, it's oftentimes they're not ready to talk. So I was just wondering, like, what approach you would take with that.
Well, I get a lot of those, and Crystal can tell you some of those, but are they showing up? If they're showing up,
Yeah.
they're showing up, that's something, right? And so a lot of times people will measure, oh, they didn't tell me about their life, they didn't measure this. Okay, find another way to get them comfortable in the room. the fact that they're coming, because you're in court order therapy, you have to tell them that they came. You have to tell them certain things, but you don't tell them a diagnosis, and you don't tell them everything that comes into those notes unless they're subpoenaed, and then a judge has to open those notes. So when they subpoena you to come, you come with the record. It doesn't mean that they get to access to everything in it. They have to give that to you, right? So one of the things that I do is they're coming. Okay, what does it mean that you come every week? Well, I have to come. I know, but you could not come and then get arrested. So something's getting you here. What's that propeller? I want my kids back. Well, tell me about your kids. Why do you like them? Because that's what's getting you in this room. Well, I have to come, and I don't want my wife I want her to drop the restraining order. Well, dropping that restraining order, what does that mean for you? See, they gave me something. I'm going to go with that something because that's the propeller. And then eventually that propeller leads to something else. And I know the realm of which I'm working in and what I have to report and what I don't. And so I look for ways to get them to open up to me. I may even start out saying, I know you don't trust me and I know you don't want to be here, but we're stuck with each other. So what can we talk about? Well, I like my job. You like your job? Okay, tell me about your job. I'm going to accept whatever they give me and then try to turn it into a different direction.
Transparency and authenticity can take you a long way. Like I had a client who was 16 and he was in a youth camp, and he knew that system. He knew how to play the system. And I remember for like 6 sessions, he was just nothing. Like he was giving nothing. He would come and he would just be like, talk to me like, yes, ma'am. Yes, like super. But I could tell he was being so fake. And so finally, one day I sat and I was like, hey, I was like, stop bullshitting me. I literally said that to him. I was like, stop bullshitting me. I said, what's really going on? Like, what's happening? And he was shocked. His jaw dropped that I talked to him like that I said that. But then from that moment on, things shifted, and his whole demeanor changed, and he started talking. So that, or I've also used like, depending on the setting, music, playing cards, like you're basically going to spend the first at least 3 sessions, just 3 to 6, I would say, building rapport and getting them to trust you and doing things that aren't related to the actual issue that you're trying to talk about that will eventually lead you to that issue, to getting them to open up.
Right. And a lot of times, it's just about teaching coping skills or a way to help them, replace things. I in the prison, I get a lot of guys who are really emotionally irregulated. And one of the things I teach them is the finger tap. And, you have the breathing and the deep breathing and bring it in and out, but they can't be on the yard doing that, right? Now imagine you're a bunch of kids and you're with your homies and you don't want them to know what's going on. I teach them to breathe and I tap their finger at the same time. So every time they breathe, their finger goes, and they're breathing with it. No one can see their finger on the side of their pants. So eventually it's not even breathing. It's just moving their finger on the side of their pants and regulating their anxiety. I'm teaching them to regulate it in a very slight way. Now, eventually it may be an envisioning in their head while they're standing there and they don't want people to know of their finger going up and down. But we're teaching them a coping skill so that they can begin to utilize that in their environment. I also began to talk about how they blame themselves. The biggest thing is that male survivors blame themselves because they believe society blamed them. You always get, well, you could have fought back, right? No one will believe me. They'll believe her. I'm not a real man. I have this guy, Jose, and he was sexually abused severely, and he was also hung upside down as 14 and sexually assaulted by a rival gang. And he never told anyone. And one day he was with his wife in the shower and she touched him and he flipped out, domestic violence. The son got involved. Ended up, the kids were in treatment and it was a nightmare. And I finally said, what is going on? Like, this is not normal. And so he told me, I never told anyone. And so he called his wife and his wife responded appropriately. And that began to heal that family. Like, he couldn't hold a job. There was always anger and aggression. And just by getting that out, he began to not blame himself for all the things that have happened in his life. And it repaired the relationship with his son. And because he believed his fate was just to be like this because he was broken. He was dirty and bad, which was not a productive way to manifest what was going on in his life. And I have another person, Nathan, he wrote a book about this, and he sent the book to me to review. And I realized after I wrote it that no one's ever told him the why that this happened to him. And he was severely abused from the age of 7 all the way to, I believe, 14. And he went to his abuser's house one day, and he was gone, just abandoned him. And this is a man that he was having a sexual relationship with, and he still struggled. He didn't understand why he would just leave. And then he found out he died, and it was years later. I said, you just got too old. And he had already realized he was going to molest you when he saw you at the pool. Like, he already had designs. He was a perpetrator. And I had to explain that from a perpetrator's perspective to him. But just telling him that, because he'd never spoken about it, changed his whole life and how he regulated his emotions, because he kept repeating all of these things this person had said and doesn't trust anybody. And so then he catastrophized everything, and you see men just blow up like a puffer fish because they just get so angry and they can't talk. And it's like, okay, you're being a puffer fish because of all this stuff, but what is that doing right now in your life, right? And learning from those mistakes, right? And I know that in the Hispanic culture, a lot of times there's, the violence and aggression goes with it, but there's other pieces that people don't think about, right, Crystal?
Yeah, with the I'm thinking I still have the image of the puffer fish, but I could literally picture like the men just, and not even, and then they do that the deep breathing and just not even being able to talk. But yeah, I'm having that image. But yes, you're right.
And what are some other things that you see?
Of what they do to start to, when they're trying to regulate.
Mm-hmm.
The biggest thing I can think of is not necessarily a positive coping mechanism, but substance abuse. Abuse. There's a lot of alcoholism, alcohol use and substance abuse, especially with teenagers. And you could even see in like younger, probably starting from like 11, 12 and going into adolescence. And a lot of times they've seen the people around them use self-medicate, basically.
Right.
So then they're like, this is the go-to. This is what we do.
Right. And you see a lot of that. You see a lot of substance abuse. I see a lot of, not being able to label that it's substance abuse because everything around them is like that, right? And then they're afraid to tell you. But there's a lot of tools that you can use. I have a Reckitt journal that I use with kids to get it out. They can actually tear it apart and put it back together and create things. Sleep hygiene, making a sleep hygiene schedule, because a lot of times people are traumatized, don't sleep. And taking a time in or a time out. My daughter is also a trauma survivor. She's a foster kid. And her thing is that she loves to run away from people. And so I give her time in. She has to spend all day with me and spend time with me instead of running away from me. Where my son needs a timeout because he's very extroverted. Overly yelling so that you go away, extreme sports. You've seen the rubber band tapping. These are all things you can do. We have another chat. Sports, working out.
Yeah.
Yes, very important. But then they can go to the extreme to where they hurt themselves because they're getting that adrenaline rush so much and they're trying to self-medicate the pain. That's something to look at. And then there's other things. Culture, does origin play a role? Absolutely, especially where they're from. You've heard us talk about that. Being silent. Saying nothing, that means nobody ever knows, right? And so that's really realize that being silent is a way that they're taking their power back in a negative way, because then they don't have to socialize around it, right? And then you have the nature and nurture issue. Is it their nature or is it what's around them? And Crystal, you're going to say something.
Oh, Dawn, I think she's probably trying to keep us on track because I think we're almost.
A little bit, but no, I kind of wanted to ask a question, if you don't
Yeah.
mind.
Sure.
What are your thoughts on young men who have experienced trauma? Sometimes their grades suffer, their behaviors in school suffer as well. But a lot of times their sports are taken away from them because of these two things. So the one thing that was helping them regulate what they were dealing with is taken away because they're struggling in the other aspects of your life. What are your thoughts on taking, schools using that as a tool for every child to keep them doing better in school, rather than looking at the fact that this is something that is helping this child who's been traumatized, the exercise, the teamwork, the social building, that sort of thing. Do you know what I'm talking about?
I'm kind of confused by your question.
Cool. Okay, so schools basically, kiddos that are struggling tend to do worse in school. When they do worse in school, they take away their sports. The sports is where they
Okay.
get their self-esteem. That's where
Now I
they
got you.
get out their aggression, and all of a sudden you've got a bunch of young men who no longer can play their sport, and they're not doing well in school, and then they completely detach from normal society a little bit.
So a lot of times I educate the schools in that. And if I have a parent, I ask how much I can disclose so I can get the school on board that those things aren't taken away. They also, but when you're working with a school district, they have certain rules that you have to go in the guidelines. So in therapy, I might make it a treatment goal that they have to have these things so they can stay in sports. And we're working in therapy to make sure those things happen, right? And so I realize that that is their outlet. If that's important to you, kind of like the person is coming to therapy and they're mandated, then we're going to make it mandated that you do these things. And we kind of build it around that, right? But having good communication within that school environment is also key, because then they understand something is going on. Right now, I have my son's in the gifted program, and there's this kid in there who is acting out in the way you're talking about. Now, he's not my kid, but I know what's going on with this kid. And he's targeting my son, which is interesting. And my son's response to him is very unique. He says, I know he has problems, so I'm just not going to talk to him. I don't want to be his friend, so don't tell me to be his friend, Mom, but I'm not going to go there, okay? And so, but he's realizing it's problems that's going on. So I told the school, I said, I don't want him out of the class. Even though he's picking on my son, this is all this kid has. I said, so let's work around how we can keep him engaged, but change these behaviors. I said, I think that is going to benefit him more in life. And so me as the parent having that conversation, those are things you can do, because that kid is going to be better off that he's where he needs to be academically than put in another class because of this behavior, and say, your behavior is causing this, being transparent in that.
I was going to say earlier, one of the most powerful things most powerful tools with emotional regulation is working with the systems outside of the child. That could be the parent if it's possible. If it's possible, definitely include the parents, teach them emotional regulation, teach them together so that they can do it together. Or work within, school systems or juvenile halls, camps, anybody who's interacting with them, if they could somehow be included in that, could be very powerful.
Right. Other questions? This is our last section, because I know we're opening it for questions, but just to give you an example of a background, there's 15-year-old, a 7-year-old, an 8-month-old Latinas and children, and the neighbor called due to noise, right? And the dog's barking, glass is shattered, people are shouting. And this is what happens when police roll up, child protective services happen, right? And it has been going on for over an hour. Now you get these kids in your office. What's the first thing that's going to go on in your head? As clinicians.
What do you mean?
Well, this is a scenario that you have. The first thing that you would probably start talking to the kids about, what would it be?
I would ask them if they were hurt. What happened? What
Okay.
happened? What happened
They
in the
don't, they probably wouldn't tell you.
Probably not, but
Why do you think they wouldn't tell you? Why do you think they wouldn't tell you?
Because it's happening in their home and it's between them and the family. They want to protect whoever else was in the home.
Right. And if they tell you,
They might get in trouble. The parents might get in trouble. They might be separated.
right, and say that did happen. So they did say something and they're separated.
Now it's their
They
fault.
now it's their fault and they're dealing with breaking up their entire family. Right. And so when you sit with them and you tell and you try to explain that to them that this is for the best thing, they're not going to get that. And then if they're a boy, the first thing in their mind is, I should have prevented it. I should have prevented it. Even if they're 5, I should have prevented it. That is something that's going to change how they view themselves masculine for the rest of their lives. Right? Crystal?
Yeah, that's, you hit, Allison, you hit the big points about protecting the family. And also something really important to think about is that the idea of parentification in Latino families, where a lot of times you have, like in that particular case, we had a 15-year-old and then younger siblings. That 15-year-old is probably responsible for those young siblings a lot of the times. And which adds to that feeling of I'm responsible for them, or they're like, that's like their babies.
Right. Could you come and introduce yourself and then let them know why you are in their home? You could, but they're probably not going to trust you. You're from the government. I mean, they're scared to death when you come in there, right? Especially if law enforcement has come in, it depends on their immigration status. There's a lot going on in those families, and especially if the older one is involved. First thing law enforcement's going to do is they're going to separate everybody out in that home because they don't know what's going on. So now everybody's separated, they're in a different room. They don't know what happened to mom. They don't know what's happening to dad. They don't know what's happening to the younger kids, and they're responsible for them. The older kids having all of this happen at the same time. The younger kids are like, I want my brother. I want my dad. Like, you have all of this. So you introducing yourself is great, but they don't trust you. They don't trust anything that's not in their home. And especially if there's a language barrier and you don't look like them, there's a whole lot going on. And then that kid gets in your office and that's going to change everything. Right, Allison? Oh, okay. You came, I saw you had something to say.
Well, and something about that situation is that in and of itself, that the law enforcement and the people coming into your home can be traumatizing in itself.
Right, and a violation, right?
Right.
And then you have some clinical considerations. I mean, Dawn, you asked the question, what about school? How do you keep them in school? Poor grades, all that stuff. Definitely is why you want to work within your exosystems. You have the macro system, which is the big system. Your micro systems are interaction, your exosystems are those systems you're interacting with microly, right? You want to work with all your exosystems to support that child because of all of these long-term effects and the poly-victimization that's happened in all those systems. You have all of those layers happening at one time, right? With all of these other cultural considerations. But I want you to understand, you need to avoid stereotyping. And because you might walk into that house and then you see dad standing there holding the kid's shoulders. The first thing you want to think is they're telling him to shut up, right? Keep their mouth shut. But they could just be very affectionate because, Crystal?
There's something that I had brought up is that they actually might be supporting their child if they themselves have been victimized in the past, and they're like, they know, even though they may not have ever talked about it. Let's say the father had previously been victimized and now he's standing behind the son, and it's almost like in solidarity. There might not be a lot of talking going on, but it's like, I'm letting you know I got your back. And I said that the reason I'm saying that, just to give you some context, is because Dr. Debra, myself, and Captain Young, she's a retired LAPD captain, who we were working together originally on a presentation where we were going to bring in a piece about law enforcement. And the first thing that Captain Young said was, oh, that son might, I mean, the father, it might be holding the shoulders to get the son to not say anything, almost like a scare tactic. And I was like, wait, hold on. That might not necessarily be true. They might be standing there in solidarity with Latinos. There's a lot of, especially with younger, with boys and men, there's a lot of like touching of the shoulders. We're just letting you know, like, I'm here, or I got you. So just something important to think about, that we can't always stereotype.
Right. And creating your clinical picture that you want to paint, right? All these questions are great, like that you're having. Paint the clinical pictures and let them build the rapport first and let them come to you. But one thing to avoid saying is, I understand. Don't feel bad. You're strong. Don't cry. Like all of these things, you're taking away who they are, right? Meet the client where they're at, but meet those kids where they're at. Because you tell them, don't cry, boys don't cry. You're teaching them to hold that in, right? All Cody wanted was someone to listen. He wanted me to listen, okay? Because no one was listening. They chained him down to a bed, right? Build that rapport with your client. They can smell, like, you know, Crystal said, BS from a mile away. Don't be that person. Be as honest and as real. And that's the one thing about me. When I realized that I can be this textbook therapist, but that ain't me. What's me is my cowboy boots and talking to you like you're a normal human being that I would talk to if I found you in Target. And that works better with this population. I don't speak Spanish, but you know what? I translated my book into Spanish. I got someone to help me. And then I taught, that's how I teach. Find a way to get it done with the supports around you. You don't have to go and be elaborate. Use what's around you to help reach that child and let them guide you. Use books, use movies, use games. One time I played Monopoly for 3 months in silence. 3 months, okay? I mean, but eventually I could say, man, why are you so sad? And he said, because my uncle did this to me. But if I hadn't did that rapport building, right? I wouldn't have got there. And that's the big thing about the Latin community. They want to feel you. They want to have that personalismo. They want to have that and bring you in. And they have to invite you in to do that. You can't force it. Right, Crystal?
Mm-hmm. Yeah.
And some clinical tools. The Latin community, Crystal, are storytellers, right?
Yes.
Explain
I use
that.
a lot of I use a lot of stories. You know, like, I don't know if anyone is familiar with. I've seen it in textbooks about like dichos and cuentos and stuff like that, where there's a lot of sayings. So you start to establish this solidarity, and also code switching is something I use a lot. Where like I know, and do it obviously in an authentic way. If you feel comfortable, talking in Spanglish, or some hood language or something, and you feel comfortable bringing that into therapy, do it, because that you're showing them like, look, I got you. I understand where you're coming from. Also, I may also have experiences that I've been through myself, and I know where you're coming from, and that's inviting to them. So yeah, and they also like to tell stories. If you make, especially we all work with children and adolescents, if you make them the expert and you act curious about something instead of just acting like you know everything, and you're like, wait a minute, sometimes they'll use the term and I'm like, wait, I actually don't know what that is, can you tell me? And they will elaborate, and then they start getting into something else, and you get more pieces of information.
And using family-based interventions wherever possible. And explore past experiences with the system. Letting them get that out is really important. And then possible challenges, top of the language barrier, inaccurate information, or information that doesn't translate from Spanish to English or whatever language, okay? So they may be telling you the truth, it just doesn't translate well. Keep that in the back of your head, right, Crystal?
Mm-hmm.
And then unable to locate, we had a responding officer who was really unable to locate any information. You're gonna find that because it just may not exist. You need to know that. And any questions so far? Know that all this stuff is on the LOU, but everything we talked about has a reference. So here are references to everything that we've talked about that you can go back and read at your leisure. But I know that we wanted to open this up more for questions, unless Crystal had other comments or whatever, but I'm gonna stop sharing the screen, and my contact and Crystal's information is in here. And at the end, you'll get a certificate if you sign up for the LOU. So please reach out because I'm going to open this up for questions. And I think we have one already. Oh, amazing resources. Thank you. Yay. Thank you, Allison.
Thank you, Allison. You had all the questions and participation, and it was awesome.
Yes. Any other questions? Well, if not, I'm going to tell you about my script conference, which is July 20th and 21st at the California Endowment Center. And you can go to or thescriptconference.com or Dr. And this Dr. Debra. The conference is about law enforcement, but it's also and people in that community, but it's not focused on that. It's about trauma and trauma survivors coming. It's free to the community. It's at the California Endowment. We have people talking about cults and therapeutic interventions. We have people coming and talking about police brutality and what that looks like to the Latin Asian community. We have all kinds of things happening this year that are crazy. And we have about 45 speakers and 45 different panels coming up. And yes, I will look that up. I'm gonna put the link in there for you.
I beat you to it because I
Oh,
got it from you.
Okay, and but please come because please
Thank you,
register
Courtney.
because we're capped at 200 and it's free. And you can come and there's breakout sessions. All the speakers are there to talk about topics people gave us to talk about to the community about. We have ex-gangbangers on the same panel as the wardens and the people who make the laws, telling them what they need versus people coming the script and telling them what they're getting. This is the only place that you will find the consumers, the people interacting on the same level. And it is one of the most rewarding things they've done. I've done this for 15 years. And people come every year, and every year we have male survivors stand up and say, I was abused. This is the first time I've talked about it. Because it's a family. It's a family. And Crystal can tell you a little bit about it from her perspective, because she is one of the people who helped me create it the first year.
Yes. Yeah, no, it's a great networking opportunity. It's a great community event. I'm the first year, I think we were all kind of shocked at, in a good way, of what came about from just being together in that space. Like I remember at the closing ceremony, we had law enforcement, we had people who were standing up there and not necessarily disclosing, but saying, this is the first time I'm ever saying this, I'm a survivor. And so you have these very powerful moments, but there's also a ton of good topics that I think we all know about, but aren't necessarily talked about in a professional setting or in that way. And yeah, if you haven't, it's also at a really convenient location. It's right next to the train. Right next to the train to the I was gonna say Grand Central, but
2 years ago we had Black Panthers, we had Black Lives Matter, and we had the sheriffs and the LAPD all on one panel talking about what the problem is. You know, that thing was gnarly and nobody got in a fight. It was great.
Yeah, it gets heated. The conversations get heated because they're big, heated topics, but it's like we have to talk about these things.
Right. But any other questions?
I was curious about how you're engaging with Latino youth via telehealth, if you've seen that change at all, or if most of your work is in person.
Crystal?
Right now, I am doing fully telehealth. I'm a mama too. So I've moved to that. And right now I actually don't have teenage clients at this moment. I have worked with them in the past. Actually, I have one that I'm going to start working
Yeah,
with.
you have a new
and-
one. I just
and
sent
it-
you.
Yeah, and it will be, and that'll be virtual, but it takes creativity keeping them engaged, right? And sometimes using technology and like things like, playing games or listening to music together, things like that through the platform
Mhm.
to build rapport.
I'm
Yeah.
completely telehealth, so I don't see anyone in person. Plus, I'm all over the place, so I only have a handful of clients that I see now.
Yeah, I think we found that it's shifted a bit, and for some clients who might feel it feels like the barriers actually makes them feel safer and they're not staring into your actual eyeballs, and sometimes it makes them talk a little bit more freely, or they can show you stuff in their house. But I was just curious if there was anything in particular for this population. Thank you.
Yeah, I agree, Allison. It's like them being in their own environment, especially for teenagers, and is a big thing. Like it helps them kind of come out of their shell more.
Well, in closing, Dr. Debra, Crystal, is there anything that if you could just say one thing about helping male survivors that you could share with other therapists that you want them to leave with?
I'll let you go first.
Believe them.
Hmm.
Believe them.
How about you, Crystal, especially with
Latinos, I'm thinking about in particular something that I want you to walk away with. I said this earlier, but I'm going to reiterate it. I think, and I'll say it in a different way. Be yourself. Be yourself with this population. Be transparent about what you know and what you don't know, and be curious. Be curious and ask them. And I think now more than ever, it's become apparent that we have to start educating ourselves and learning more about providing culturally appropriate treatment and how that can make a huge difference and impact in therapy.
Right. And also, when you're in the room, people hear me say this all the time. I always say, let's listen, let's love. And I don't mean hearing people's words, wah, 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 right? You can hear people's words all the time. But if you listen to the words they say and you always respond with a place of love, there's nothing you can really say that's wrong because your motive isn't anything negative. So don't just listen to the words and respond from that place. You don't have to be in love with them or anything, but respond with your heart. That will change everything and clients' barriers will come down. So let's listen and let's love together. We're in this world together and it's a crazy world right now. So if we all could do that, things would be different.
Well, I want to thank you guys both for coming today and sharing what you have with the CVCA chat grant recipients. Again, guys, if you guys have any additional questions, the link that Dr. Debra provided will let you go through the course, additional background information. It'll provide you with a certificate, but also access to the website with other trainings that are available to them. Is that correct?
Yeah, it's well, they'll have to pay for those, but you can go through this training and you can pay for the other trainings if you want to. And you'll see our bios and everything on there. And I'm doing this one now, and that's East Hampton's or Comedy for Kids, where I'm teaching kids about social emotion, how they can use themselves to get over their barriers. It's really, really cool.
And keep an eye out, guys. I think Dr. Debra may be on TV soon. So,
Well, I'm already on CBS UK. You can look at that.
yes. Well, thank you guys. Thank you everyone for coming. I will send out a thank you if you need a certificate. There's one at the end of the Listen and Love University, but I can also provide you one if you need one for work. And have a fabulous day, and I'll see you at the next Let's Chat.
Thank you all. It was great being with you guys.